Today's topic is Ayushman Bharat. Ayushman Bharat introduced in 2018, and it is an attempt to move from a selective approach to healthcare to deliver comprehensive range of services planning. And the spanning of this Ayushman Bharat includes preventive, promotive, curative, rehabilitative and palliative care. Two components of Ayushman Bharat. It has two components and which are complementary to each other also. Under its first component, 1,50,000 health and wellness centers are there, and it will be created to deliver comprehensive primary health care. That is universal and free to use with a focus on wellness and with a focus on wellness and delivery of an expanded range of services closer to the community. The second part, the second component is the Pradhan Mantri Jan Arogya Yojana, that is PMJ, which provides health insurance cover up to rupees 5 lakhs per year to over 10 crore poor and vulnerable families for seeking secondary and tertiary care. To say about the health and wellness centers now, health and wellness centers are envisaged to deliver expanded range of services that to go beyond, and it includes maternal and child health services, to include care for non-communicable diseases, palliative and rehabilitative care, oral, eye and ENT care, mental health programs, first level care for emergencies and trauma, including free essential drugs, diagnostic services for the poor. So, we can see that Ayushman Bharat, it includes the health and wellness centers. Coming to this health and wellness centers of India, there are 57,520 health and wellness centers are there, and 34,156 state level health centers of health and wellness centers are available. There is 1,19,548 primary health and wellness centers are there. Again, urban primary health centers, there are 3,816 urban and primary health and wellness centers. These health and wellness centers will have a community health officer, that is CHO, who may be a BSc nursing or an Ayush doctor, trained in various aspects of occupation, trained in various aspects of patient's care, covering all the components of services. We can look into the different services covered under the health and wellness centers. You just go through that, There is a comprehensive primary health center through health and wellness centers. And you just look into that, it's a universal access, it is there, and it is affordable, and it is quality linked and equity oriented. We can look into the services covered under health and wellness centers. A lot of programs are there, an expanded range of services. One is care in pregnancy and childbirth, neonatal and infant health services, childhood and adolescent health care services, family planning, contraceptive services and other reproductive health care services, management of communicable disease including national health programs, management of common communicable disease and outpatient care for acute simple illnesses and minor ailments. Screening, prevention, control and management of non-communicable diseases are covered under this. Care of common ophthalmic and ENT problems of the patients. Basic oral health hygiene and its care. Elderly and palliative health care services. Emergency medical services. Screening and basic management of health ailments. All are covered under this health and wellness centers. Then, again going to the expanded range of services of this health and wellness center, the expansion of services has been planned in incremental manner As a first step, screening, prevention, control and management of non-communicable disease and chronic communicable diseases like tuberculosis, leprosy, all are coming under this health and wellness centers. And you know that again there is a repetition, just that the key components of health and wellness centers, we can see a continuum of care. It includes the telehealth and referral systems also, expanded service delivery, expanding human resources and multi-skilling, and there is a partnership for knowledge implementation, community mobilization and health promotion, and all are supported with a robust IT systems. There is financing and provider payment reforms, medicine and expanding the diagnostic techniques. All are coming under this community primary health centers through health and wellness centers. Key components of health and wellness centers. One is the delivery of community primary health center through health and welfare centers, involving its complex tracks as it requires a paradigm shift at all levels of health systems. The operationalization of health and the operationalization of the health and wellness centers requires several inputs. We can go through the key milestones of health and wellness centers. This inauguration of first health and wellness center, that is it is under this community primary health center application at Jangla, Bijapur on April 2018. The operational guidelines on comprehensive primary health care, it was finalized in July 2018. And again, now there is 1.5 lakh health and wellness centers are there. Then in the budget 2018, a total that in February 2018, budget announcement of health and wellness centers in the financial year, and again this budget allotment was there for this health and welfare wellness centers is there in the 2018-19 budget. And again national consultation on comprehensive primary health center was done in May 2018. And this on March 2019, this health and wellness centers was in operation. Again, to say about the key milestones of health and wellness centers, the first health and wellness center was launched in Bijapur, Chhattisgarh on 18 April 2018. In the first year, over 17,000 health and wellness centers were operational, more than target, that was only 15,000 set for the financial year 2018-19, but 17,000 centers were inaugurated. And to say about the rollout plan of the health and wellness centers, in 2018, only 15,000 crores was allocated. And in 2019, you can see that in 40,000 is steadily going up, 70,000 in 2020-21 and 1,10,000 in 2021-22, and in December 2022 it is 1.5 lakhs. To say about the rollout plan of this health and wellness centers, given the magnitude of inputs required to strengthen the primary health care facilities, and everything is provided for the health and welfare center has been planned in a phased manner till the year 2020, and it is going on. Thank you.